I'm not a doctor. I'm not a researcher. I'm not a medical professor. I'm a mom. A lemon-sized tumor was in my cavernous sinus. Other doctors outside of UCLA repeatedly told me, I don't think you're going to make it.
Say something, I'm giving up on.
When my son was 3, I lost the hearing in the second ear, and I wasn't able to hear at all. At that point, I had nothing to lose. There's too much to miss every day.
My son was experiencing a number of difficulties. We suspected that he had some hearing loss, and he was also having trouble breathing at night.
And for about 4 or 5 months, I'd had an earache and a sore throat. I was diagnosed with stage 3 tongue cancer. The Lord delivered these angels, and Dr. Berke was the first of the angels.
So, tell me how it's going today.
Well, much better today.
Much better?
I think
You've been
so,
taking
yeah.
the medicine?
I have.
Well, I'm the first chairman, but the department's been around since probably the 60s when UCLA was formed.
We were only 4 clinicians, 5 residents per year. The goal was to be #1 in the country, possibly in the world.
Paul called me in April 1969 and said, you can come to UCLA as on a full-time faculty.
A no-brainer.
UCLA, that sounds great. We're probably 5 times the size that we were when we started. We certainly have become one of the major training centers in the United States.
And we built a fairly strong program, in fact, probably one of the strongest in the country.
And we're going to record your voice in the studio again.
Oh,
okay?
very cool.
See how it's better.
All right.
Dr. Berke has been the best possible inheritor of Dr. Ward's legacy. Dr. Berke has allowed not only the program to expand, but to expand wisely.
Probably our bailiwick is taking care of serious cancers of the head and neck. We have a great plastic surgery reconstructive program to go along with our extirpative program, and we're in the process right now of even getting to the next stage and developing a multidisciplinary head and neck cancer program.
We really are bridging the gap between taking care of the patients at the bedside and working in the laboratory, which is really the beauty of translational medicine. We also are striving to provide this multidisciplinary approach in one afternoon, so patients can see all of the specialists, have their questions answered in a very kind of global, holistic approach to the patient.
Not too much pressure, just a little.
Okay.
We have new instruments that we use, we have new techniques, new technology that leads to easier recovery, fewer complications.
We probably have the best testing capability to describe imbalance disorders. We can systematically diagnose a problem and provide the needed treatment.
It's a blend between hope and honesty as far as the patient is concerned. You can never take away hope. At the same time, you have to be honest. We had a philosophy of really going for the cure. We did indeed cure many, many patients.
The change in my son was immediate and very gratifying. He was a happier little guy, and he could hear.
To be able to get that sound back into my life and hear my children, pretty phenomenal experience.
It's a miracle that I'm still alive, and I owe it to UCLA.
As I look back and think about what's happened in my career, I certainly believe that I've achieved what I set out to do.
It's a very personal connection, and it's different for every single patient, but I think you basically realize that you're transferring a little bit of yourself over to that person to try and help heal them.
I knew that this was the place for me. I just knew it. I knew it like when I married my wife. This is the woman I'm going to spend the rest of my life with.